Today, we will be talking about the health system in Nova Scotia. Good morning, how are you? I'm sorry I've been so out of this, but I've been doing a lot of renovations in my house, so it's been taking quite a long time. But I hope you had seen my interview with Gabby. She was recruitment specialist, and for those of you that haven't heard it and that are from English or non-English speaking countries but that you don't speak Spanish, I will make a little summary about my conversation with her, just to give you some tips on how to get a job here. So today I asked a couple of weeks ago some of you, what did you want me to talk about? So Antonia said education and the health care system in Nova Scotia. So that's what I'm going to talk about today, just the health system in Nova Scotia for immigrants. I think that one of the most or the best statuses is for refugees. I think that they get the best health care of all of us. So what's included in the healthcare package for them? Okay, so I was a refugee, so this is why I know. So when you come in, you need a lot of things. You need even help with mental health and things like that. So it basically helps you, like if you need to go to the doctor, it will cover you that. They will give you a little paper in a burgundy color, and that would be basically your health card. So as a refugee, you're also more likely to be helped paying your prescription. Also, if you need some dental and optometric services, it will cover some of it too. Doctor referral to specialist, just like the rest of us. Something that I tell everybody, even if you're a refugee or not, it's to always ask your family doctor for for a therapist. Mental health, it's very important. If you have a brain, you really need somebody to help you with that. So I definitely recommend that, no matter if you're a refugee or not. So it's definitely something that everybody should get. No matter where you are from, coming to a new country, it's difficult because it's something new for you, and it's something different. So this part is very important. So take care of your brain, take care of your mental health, as well as, like the environment here might be different from where you're from. Well, it's definitely different. So again, this is very important. Get a therapist, very important. Okay, now for students, that's totally different. If you come as a student, you definitely need to get health insurance. So if something ever happens to you and you need to go to the hospital, your insurance will pay for it. If you don't pay for this, you will have to pay for everything, for your stay, for the medicine, everything. But if you have insurance, they will help you pay for that. So it's very important. Insurance here for everything is very important, because otherwise it's going to be really hard for you to pay back. So if you have a car, you need insurance. If you have a house, I recommend you insurance. So insurance is very important here. I repeat myself again, please do not come here if you don't have a job and if you want to join the AIP program. If you get sick and you do not have a status, you will have to pay between $40 and $50 just to see a doctor for around 15 minutes. And you'll definitely do not have any kind of coverage with prescriptions or anything. So I knew these people that they came here, and the guy had to get a surgery to get his appendix removed, and then he had to get something else out, and he ended up owing around $50,000 because he didn't have a status here. So again, this is very serious. Okay, so finally I am gonna talk about the status for AIP, and probably programs that are similar to this one, as well as citizens and residents. So I put these together because all of us have basically the same rights. So you basically get your health insurance, your health card, and you have the right to go to a walk-in clinic or see your family doctor, use the doctor, use your referrals. Again, your kids can use some dental, things like that. But if you have to get a prescription, again, all of us, like if you get a job or something, it's most likely that your job will give you some kind of insurance after 3 to 6 months that you've been working for them, just to cover some of your prescriptions. And it could be something else like physio or massage, etc., as well as optometrics and dental. Just to let you know, optometrics and dental, massage, all of these things are not covered by MSI. You will have to pay for this if you need these services, but if you work, you are most likely to be insured, so your insurance might pay for these things. Also, the last thing that I wanted to say about this is that the average wait that you have to find a family doctor, I think right now it's about 6 to 8 months. So like I said, the health system here is it's not poor, it's really good, but again, we are in need of doctors, nurses, and everything like that. So if you're trying to find a family doctor, it's really hard right now. We don't have enough staff, and we need people here to help us with that. So that will be it for today. Thank you for watching, and subscribe. If you have more questions, please let me know, and we will talk about more things about Canada that you are wondering how they are. Have a good day.